do you suffer from trismus? And if so, we're going to provide what is that definition, but then do you know how to stretch your trismus to help improve your ability to open your mouth? So trismus is a sign of very severe limited opening. The definition for trismus is 20 millimeters or less, right? So that's someone barely opening. I'm going to have Abigail demonstrate here. So she's going to open a little wider and lightly close. So right about there, right? That's 20 millimeters. So, right, you're not opening very wide. Pretty hard to eat most foods, hard to have a dental cleaning, anything like that. You can relax for now. When might this occur? The two common times we see this occur could be if you've had maybe a dental procedure and you're suffering an infection. So if ever you had normal opening and a day or two after having a dental procedure, you severely lose your ability to open your mouth, you should immediately be calling your dentist to get back in their office to determine if there is the possibility that you're just suffering a low-grade infection. Not to worry, in all the instances I tend to see, if it is an infection driving that trismus or loss of opening, once you get on an antibiotic, usually 7 to 10 days later, you will open right back up with no long-term complications from it. The other reason I tend to see this occur is when a dentist is doing a procedure, they often has to use numbing medication. And when they inject you intraorally, they have to go through the medial pterygoid muscle because behind that is the inferior alveolar nerve that they numb. And occasionally, it's unfortunate, but right, like with all things, there are potential risks. You can develop a hematoma in that particular muscle, or if they were to do both sides, if they were doing some kind of bilateral work, again, all of a sudden, maybe a day or two later, you're going to notice severe limitation of opening. Again, you need to get back to your dentist right away. And if they're unsure of exactly what's going on, please find a really good physical therapist that has some training in TMD and TMJ issues. My word of advice to you is the sooner that the trismus gets diagnosed and the sooner you start receiving care, the quicker you will respond. I am sadly sometimes seeing people 4 and 5 months after the fact, and they have very limited opening. We do get them back opening to normal, but it can take months, maybe even a year, once that tissue has become fibrotic and shortened. So here's just some simple ways to start. But again, I really encourage you to be seen by a skilled professional so that you know how to do this correctly. But first, you're going to want to try to get a caliper so that you can start to accurately measure your opening. So again, not uncommon that someone might present in our clinic at only 10 millimeters of opening. So to represent 10 millimeters, right? Very limited opening, right? You can probably barely get your index finger or pinky between your front teeth. So let's say that's your maximum ability to open. You're going to need to buy a box of tongue blades, roughly 6 inches in length. They usually come in a box of 500 or 1,000. They're super cheap. Then what you do is your therapist should be stacking your tongue blades with a rubber band. If you will notice, I have one tongue blade out because the idea would be when these are compressed between her back teeth and I go to measure those, right? That's about 5 millimeters of opening that her back teeth need to open. Obviously, we could use less sticks. But the idea would be to put these sticks on both sides, even if we only think one side is the problem side, with the additional 1 or possibly 2 tongue blades sticking out. So the goal with this would be that at this point, you're feeling a little bit of stretch in those tissues, maybe on a scale of 1 or 2 out of 10, 10 being a severe stretch, very mild. We're going to leave those in there for a minute or two, and then usually what I find is effective is I will have someone bite down on the tongue blades gently for 5 or 6 seconds. So they're going to bite down, bite down, bite down, and then I'm going to ask them to relax, and then I'm going to ask them to try to slowly open. Don't, in your case, because she does not have trismus, right? The goal would be then we're going to take the next tongue blade, right, and we're going to methodically slide it back in, right? And now we have made that opening between her back molars about another millimeter or so. It really depends on the thickness of the band, of the tongue blade, so I always take that into consideration. So little by little, as our patients are coming into the clinic, we are adding more and more tongue blades to basically help distract and stretch the joint in this manner. So we're not causing compression in the joint, we're causing decompression and stretching. As they progress, Then we start to take, again, another series and stack of tongue blades. And remember, you need to know how far can they open when they come in the clinic. You're going to put enough tongue blades in there so that you mimic what they can open to. So let's say right now we've finally been able to get Abigail to about 15 millimeters of opening. But over time, when we put all of these tongue blades in, she's now going to be able to open to 20 or 19 millimeters, give or take, right? Somewhere in there. But again, this is a way now for us to progress not just from a distraction, but in opening maneuver and mechanics. So we're going to slide a few of these tongue blades out, and I just call it like, right, it's sort of like we created this tong effect, right? Think about tongs that you would use on a grill when you're grabbing your hot dogs or that type of thing, right? It's a tong effect. So when I compress in the front, so sometimes I will initially still leave the ones in back, but I'm going to take them out for demonstration. So they might still have the ones in back, right? But now we're going to start to work on putting these between her front teeth. So she's going to open just enough, right? Now she's pretty limited, right? At this point, she might be feeling a little discomfort and subtle stretch. I'll usually maintain this with them in there 30 seconds, a minute, somewhere in there. Again, I will have her bite down. As she bites down for 5 or 6 seconds, then I will tell her to relax, try to open wider, and as she opens wider, I will methodically, little by little, slide one more tongue blade in at a time until maybe over the course of 3 or 5 minutes, I'll be able to slide 1, 2, maybe if you're lucky, 3 tongue blades. Just remember, that's going to be a significant change. And now, if they weren't in discomfort, they might start to be feeling some significant discomfort. Usually, my recommendation is that people need to do this at least twice a day. Start out with maybe 3 minutes of this stretching program twice a day, working up to at least 10 to 15 minutes twice a day. I firmly believe in a more lower load stretching, but a longer duration to actually stretch the tissue and get it to remodel so we can get to that new length. All I can tell you is, as the patient who suffers from this, you have got to do your homework. Seeing a therapist or a dentist once or twice a week for this will not be enough. You must do your home exercise program if you expect to see a change. And if you happen to be a chronic trismus, meaning you've been walking around with this for months, just know it requires great patience. Studies have shown you might barely gain 1 millimeter a week. So that means you might only increase your opening 3 to 4 millimeters every month. So if you're coming in at 20 and you used to be at 40 or 45 millimeters, right, you can do the math. It's going to take months to get you back to where you were, but you will definitely achieve it, but you have to be disciplined and stick with the protocol. Any questions, give us a call.